They all got a text message confirming their slot had been scheduled. Once they have shown their IDs and answered a few questions, it only takes a few minutes. For many doctors and nurses who have been on the front line in the fight against COVID-19, getting the vaccine is more than a way to protect themselves. For Dr. Guerra, who despite her health issues has carried on treating COVID patients, it almost feels like the end of a nightmare.
I was very anxious at the time I was working in the COVID-19 ward, so you can imagine what a meaningful experience today is for me.
This young nurse who works in an A&E recently recovered from COVID.
It's impossible to explain what has been happening inside hospitals during the pandemic. Many things have been said about it, but those who work there experience it in a different way. Both when it comes to realizing that sometimes there are battles that you cannot win, but also because we feel ill ourselves. Every day we are overwhelmed by emotions. Today in particular, I feel very anxious.
In the past, she had a few doubts about taking the job.
Yes, at first I was scared to get the vaccine, but given my role, I could not say no. I have to do it for the sake of the whole community, for everyone.
Loredana has been administering the vaccine since day one of the campaign. She tells me getting the vaccine can improve teamwork.
There has to be a good relationship among us colleagues in order to work together to face and overcome such dark times.
The director of the local health unit believes an important milestone has been achieved.
It's the very purpose of what we do and the service we provide, which is not simply about fighting against an emergency, but also protecting the community. The vaccination campaign is a good example of that.
Vaccination rates vary from region to region. Here in Lazio, around 70% of the delivered doses have been used so far. Health authorities in the Lombardy region, Europe's epicenter of the pandemic, have been under attack for administering far fewer vaccinations than they planned. Keeping the growth in the number of COVID-19 cases in check is said to be crucial for the effectiveness of the vaccination campaign. And while there is an ongoing debate among health workers on whether or not the vaccine should be made compulsory for them, for many doctors, being the first ones to receive it sends out a message of encouragement to those who are still hesitant. That's why they wear this pin which reads, "I'm getting the vaccine." Giorgio Orlandi, Euronews in Rome.